FELS, or focused echo in life support, is used to find cardiac pathologies such as cardiogenic shock, pericardial tamponade, signs of submassive or massive PE, and hypovolemia.
Feel free to pause the video to look through this 2-page document that describes how to do focused echo, save the images, and the positive findings of cardiac pathology with echo. For echo, we use the phased array or the cardiac probe, and we set the ultrasound machine to cardiac setting. The parasternal long axis view is found by putting the probe on the fourth intercostal space just next to the sternum on the left side, with the probe marker pointing towards the right shoulder. From here, to get the parasternal short axis view, we simply rotate the probe 90 degrees clockwise until the probe marker is pointing towards the left shoulder. With echo, getting 4 or 5 views, with each view we are assessing for the cardiac pathologies that we look for in the emergency department. Often these are best seen with 1 or 2 views, but getting all views helps us to identify the full picture. The next view is a subxiphoid view, which is just under the xiphisternum, with the probe marker pointing towards the patient's left. This can be confusing with cardiac settings, as with EFAS the probe marker is pointing to the patient's right. You want to ensure you have enough depth to see all the way around the heart. This view is often the best view to then assess the IVC, the inferior vena cava. To do this, rotate the probe counterclockwise until the probe marker is pointing towards the patient head, about 90 degrees. You may have to fan a little bit to see the IVC. In this view, you could freeze the image to measure the IVC diameter and ask the patient to sniff to assess for collapsibility. The final view is the apical forechamber. This is with the probe just under the left nipple and the probe marker pointing between 2 and 3 o'clock. Changing the patient's position into a left lateral decubitus position often helps with this view and can be used as well as a supine position for all the cardiac views.
This completes the FELS ultrasound exam.